how does this not exist? And what are you going to be your KPIs and how you could make this your entire practice? Can you believe that we're leaving the hospital and our discharge instruction is this one line? My ideal person is the person who says, hey, I'm lost in the system.
DPC is kind of hopefully an extension of someone's medical career, as opposed to burning out, flaming out, and quitting.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in.
Welcome back to DPC Life, the podcast where we talk about all things DPC and beyond. And I'm very excited to have Dr. Brian Bost back with me today. He is internal medicine and pediatrics boarded hospitalist in Denver, Colorado. This is the second of our series of hospitalists to DPC. So thanks for coming back.
You bet. Yeah, it's great to be here. And I've enjoyed hearing some of my other hospitalist colleagues recently on your podcast.
Yes, I know. I've had so many. And we just had a resident come on too. She's finishing up. So it's great. We're getting new DPC colleagues from all different areas. It's
awesome.
Wonderful.
That's fantastic. And it's great when I see these residents making the leap directly there. And I think I just saw something on DPC Alliance. It's just fascinating to think that this is an option and to start this lifestyle right out of residency, or not lifestyle, but this practice of controlling the variables that you want to is just a fortuitous gift to everyone who's worked to make this movement happen.
Yeah. And when I came out, and I guess with you too, I would never have thought it was never even an option.
Right.
No one said anything about building a private practice.
Right. And especially for those of us who never even thought we would be in this space, I think, especially. And, I had a conversation recently with a specialist who has been fee for service forever in a hospital system. And I think, again, the inertia to get going seems so insurmountable, whether you're a hospitalist or you've probably been in fee for service or a specialist. And again, I think that's just kind of the great thing in the messaging that I've been enjoying getting out is it feels insurmountable, but really getting the LLC, there's a lot of fun along the way. And sometimes you want to pull your hair out, with some of the process, like finding an office space.
Yes. So speaking of, I can see, and so for those of you who are listening, I'm sorry, we will try to describe. Dr. Bost is in his new office. Tell us all about it, how you found it, how it's going.
Yeah, so it was pretty funny. After we did our first recording, literally the next day, I put out some feelers kind of early on, and one of those contacts called and said, we actually think we're going to have an office open. Would you want to take over a lease in 2 weeks? And I was like, wow. Okay, thank you, universe. We threw it there. And so it moved the whole conversation ahead. It didn't end up working out, but I went and looked at the space and it really helped me to put that vision out there. So I was a bit disappointed. I think with all things business-like, I was made to feel like this was being held for me and it was going to be a great opportunity. And lo and behold, I was probably number 3 or 30 on the list of potential people. And I have a brother in commercial real estate. These things happen, right? It's important for them to fill the spot. But it was great because for me, it kind of cut that umbilical cord of it felt great to actually envision a space as my office. And then so the next day I licked my wounds and it was interesting. I read a lot on the forums and Facebook about how people have gone about office searches and got on LoopNet and was just kind of assessing the market. And I ended up finding a fantastic space going through USA therapy rooms. So I know I've
not heard of that.
Yeah, so I have a couple of friends who are psychotherapists or counselors, and oftentimes they will basically sublet a spot out of another therapist's office. And I think the beauty of this ability to practice is I needed the hand washing sink close. I didn't want a space that didn't feel right. And so simultaneously, I went through the normal realtor route and looked at some properties that felt unusual. And then I went through the USA therapy route, and practice had reached out and said, I think a DPC would be a fantastic fit at our practice. And I'll tell you about where I ended up in a second, but it was interesting because it's like buying a house. So I walked into some offices and I thought, okay, this could work. Am I selling myself short? I thought, what is the patient experience? And I thought, boy, if I was waiting here as the only patient for a solo DPC it may feel a bit creepy. So I looked at these.
Okay.
Yeah, some of these had waiting rooms, but it was like a big waiting room for a solo practice.
Yeah.
And so the last place that I came to is actually where I ended up running. And so through USA Therapy Rooms, I think that's the name, I'll double check, I found a room. It's actually an acupuncturist practice that has had physical therapists, massage therapists, mental health workers. The practice that I'm renting from has actually been here about a dozen years, and a fantastic building in my ideal location. And again, I was thinking like,
Perfect.
yeah, it was perfect. I walked into the space. I thought, what's going to feel like when you don't know me or the relationship? And I thought, okay, you sit here, there's a natural waiting room. It won't just be me. There'll be a little bit of a buzz in the office, but it doesn't feel like you're walking into like a medical clinic. And I just fell in love with that idea of it's very much centered around wellness. And I looked at the room. I have a balcony, I have fresh light, and tons of patient,
Cool.
and tons of patient parking. So, and I don't mind saying it's just over $800 a month. So I felt like I felt like I won the lotto. It was the last place I looked at. So when I finally walked into the space, I saw places again that could have worked, would have cost double, challenging leases of trying to haggle, negotiate, especially to not have a 3 or 5 year. And then I walked into this space and I thought, all right, this is it. And that's kind of where the next journey started. I was like, wow, there's a lease, and now it's time to figure out where to go.
Yeah. So the USA Therapy Rooms, that's really interesting. I feel like somewhere along the way, I saw something similar for physicians' offices. Did you run across that? in your research?
I think there's a couple companies mostly centered around like the Florida market, the Dallas market, the Houston market.
Cities.
Yeah.
Big cities, yeah.
Yeah. And some of those were kind of companies that created the spaces that you could rent from. It was interesting. I had a tough time finding something similar in the Denver market. And I had looked at some of the other practices, especially some of in the area that I wanted to be in, there was a bunch of like plastic surgery offices. And I considered that was going to be my next step, is to start to reach out and see who had a room. Because I didn't want to be in an enclosed environment with just myself. I wanted some of that connection. And
Sure.
so here I am.
Well, that's a great place because you can refer to each other.
Yes. So it was a great, and I've referred to acupuncturists my entire career. I actually worked with an acupuncturist in my global health practice who worked with a lot of oncology patients. And similarly, they've had different physical therapists. And I enjoyed that idea of, boy, here's an acupuncturist that I could also refer patients to. So yeah, that's great.
This is very tangential, but auricular acupuncture. Have you
I have
seen that? Or?
I have, yeah. I actually have a pediatric hospitalist colleague who got certified in it. Yeah.
Very cool.
Yeah, it's super cool. And again, I think that's also what I liked about where this office is. I didn't walk in feeling we're medicalizing disease. I felt like we were embracing health and healing. And I know that sometimes, especially for hospitalists, this is too touchy-feely talk, but I think it makes a difference. Well, I mean, we only know hospitalists where everything is medicalized. You walk into a hospital and you think you're walking into a museum, and you're in the private section of the Cleveland Clinic or somewhere, Mayo. And so I enjoyed that aspect of, here's a practice dedicated to wellness, and let's go with that.
Yeah, awesome. That's great. So you said it's an acupuncturist and is there someone else?
Yeah, so right now there's 2 therapists. There was previously a pelvic PT who was in the space, and I think there's still space for one other therapist or whoever. But that was the other nice thing, is that the space has been intentionally cultivated and very cognizant of making sure styles match, goals match. I liked that feeling of multidisciplinary treatment team, but we're all individual practitioners.
Right. Yes. Okay, great. So last time we talked, I think one of the biggest goals was trying to find a brick and mortar. So check. Good job.
I check. And then I was like, wow, now it's time to actually furnish. And I was lucky. I ended up with a gap in between kind of locums hospitalist work. And I said, well, let's make the brick and mortar work. Let's throw it out to the universe, because I started to rework going from a telemedicine only to the brick and mortar. But also, we chatted a little bit last time about changing the fee structure. And I wanted to really start to work on the concepts of the services that are based around brick and mortar, care for hospital transitions and medical complexity. And so redoing a website and working on some of the consenting. So it conveniently all came together kind of right at the right time.
Yeah. Great. So have you been putting out any information about the brick and mortar for new patients?
Yeah, great question. So I'm away next week and the spot was great. So I feel like I'm doing a soft launch. And so I created my first newsletter and that went out exclusively to friends and family in that very small client base that I have now, with just to getting the word out slowly. And part of that is having got a brick and mortar established literally 6 months earlier than expected is great. But I also know that I've got some fun things. Like I'm going to DPC in July. And so,
Yes.
so I don't want to generate the wrong amount of buzz and then be like, oh, sorry, even though I'm brand new, I can't see you for 2 weeks. So I'm feeling like a slow launch until after DPC and then really start to work on marketing and getting the word out there.
Okay, I'm going to push back on that a little bit. Why can't you?
Well,
Why can't you?
right. Yeah, I know.
If a patient needs a doctor, right, they're waiting 3 months, 4 months now.
Yes.
You're going to wait 2 weeks for you?
Yeah. So that's the funny thing. I want to keep the capacity for the potential handful of people who hit me while I feel like I'm kind of gone, right? And the nice thing about already being telemedicine established is it's not a barrier to me to onboard. But I think part of that is just kind of my own bandwidth. I didn't want to, I love the pushback because it also, what I feel is that, again, I'm in a great spot where I'm able to build with financial cushion, right? As opposed to, I think things would be different if I was like, okay, I mean, I feel a little bit now, instead of just having my EHR and kind of the other IT platforms, and a little bit of marketing, now I'm like, okay, I'm paying for a space. How am I legitimizing having that space if I'm not like ramp up? And so I feel a little bit of that push and pull. But for me, I want to really focus on enjoying DPC conference away next week.
Right. Yeah.
With that solid goal that, yes, the ramp up comes when it's there. But if somebody reaches out now and I have a couple meets and greets scheduled this week and next week, to slowly build it. So, and then there's a couple of other weird things like the exam table I ordered got broke on the way here. So, yeah. So I thankfully have a friend has lent me her OMT table, but otherwise the space is ready. It feels great.
Fantastic.
Yeah.
Yeah. Like when we started, we used, I think, Rachel's massage table, kind of portable.
All right. Yeah.
It was okay. We had what we call Goodwill chic.
I love that. Well, it's kind of and again, it's the things I was like, oh my gosh, I need patient gowns and I need pillow covers. And I think I've had like a running commentary in my mind. Cause again, honestly, the biggest thing I bought was a credenza. I'll show you the office here in a bit. The patient chairs I got, and I bought a Keurig. And cause I was like, I want this to be a comfortable space. But at some point you're like,
sure.
And I was thinking of Paul Thomas's book. And I'm like, if I had to like write out this chapter, I'd be, God, I spent $90 on a Keurig, but this is micropractice and keeping it cheap. And so it's kind of funny. You have these discussions of like with yourself, sometimes others, of like, what makes the patient experience better? And is that necessary? Is that silly? Yeah. So it's been fun. And how did people do this before Amazon or Wayfair or, or the amazing groups? Like there were a bunch of practitioners in Colorado offering and offloading a lot of equipment. So this was my intentional first. So as a hospital, I've never had my own office. Like I've always been in a shared office. There's never been a need to decorate. I think the thing I was most proud of was the photograph of the doctor. And I kind of use this as the story of when the whole progression of healthcare, this was the original physician experience of being there for the patients, not being bogged down in a computer or tech, but really just what is that bonding and that connection. And the funniest thing is, I think this is the first thing I picked out for the office before anything. I've never had a copy of the painting, and I just thought, I want this to be prominent. When patients come in here, they can scan a QR code to read about it. When I see that photo, it again ties me in. And that's one of the funnest things about having my own space, was finally getting able to kind of put that own stamp on it.
Yeah. No, it's so fun. It's because your home can be different because sometimes you're sharing, of course, with your partner and you can't make it exactly the way you want it sometimes.
Right.
So in the office, you can just have at it.
Yeah, exactly. For sure.
Very cool. So what else are you working on now? with the DPC?
I think I'm really starting to work on that elevator pitch. I'm working on, kind of defining why I came into this space. And those are kind of the things for me, and especially kind of having listened to a lot of people in the elevator pitch. I think my why is very similar, but even the therapist here in the office said, well, what's your ideal target? And I'm like, oh, yes, that's such
So
the tough
hard.
one. And as I've listened to everyone talk, I feel like a lot of times it's geographic based. I want to take care of my community. I'm in rural here where there's no healthcare, or I want to focus on menopausal care or men's health or pediatrics. And I think a lot of my work, especially in global health before pandemic, was around health equity. And I keep coming back to this messaging of my ideal person is the person who says, hey, I'm lost in the system, or start with the pain point, right? The pain point is, do you feel lost? Do you feel like you don't have anyone in charge of your care? Are you so confused by not understanding the specialist that you need one person who's there? And that's kind of the messaging that I want to finesse a little bit, especially populations that are in and out of the hospital frequently or have that level of medical complexity. Lots of the geriatric population, although obviously the Medicare is an issue, but I want to be cautious to also not just feel like I've got a patient panel that is on such a medical complexity level that I don't get to enjoy having some families in the practice, or people who don't have that level of complexity, but maybe there's one medical issue that hasn't been well defined. So that's kind of where I'm working on now, as well as then slowly figuring out kind of how much I want to be on social media.
Yeah. It's not the only way to get patients, for sure. It's like work one way or work the other.
Yeah.
Ideally, you want a little bit of both, right? So in person. And so, how about in person? What are you doing, or what's your plan?
Yeah, I've not actually worked on that plan. I think part of that, as opposed to just trying to bring the service to a large mass, I feel like there's a bit more of a selective. So part of this has been to work through physician networks and contacts here. Having been in this market for a long time and away a little bit, and a couple of family members in healthcare here, that was kind of my initial thought is, how does that look like as opposed to, say, the farmer's market or the Chamber of Commerce? And that's probably where I'll network a little bit more, and especially at DPC Alliance, and look to kind of hear some of those models.
Well, the DPC Summit, you're going to have a fantastic time.
Yeah.
You'll hear so many different ways that people have networked and gotten patients. You'll love it. It's a lot of fun.
Yeah. So, but I think these are the conversations. It's so funny, when I was thinking about our conversation today, I thought, okay, this is great. I ended up where the challenge was 4 or 6 weeks ago, and it's such an evolution. And I think especially for those of us who've never seen what it's like to open up a practice and have to build that base. I mean, open up a hospital, there's patients the next day, there's a hospitalist, right? And we've never had to traditionally compete with other hospitalists, because usually there's one set of hospitalists in the system, right? So yes, these are the nuances that will be driving our future conversations for sure.
Yeah. So when you do go to the summit, like, what kinds of things are you hoping to learn about?
A couple things, really. One is a little bit about kind of the outreach. I think especially I'm signed up for some of the office-based procedures and just things that I've not done. I think I'm curious to hear what's out there, but remain true to the micropractice model and not feel like I need to sign up for every service that sounds cool. And I think, and part of that is a lot of the services that are increasing right now, the dermatology, remote tech, the longevity, the wellness. It seems, I'm a tech guy. I would love to have a little bit of all this, but at the end of the day, I want to make sure I'm hearing the consistent message of the people who are running the micropractices and keeping it simple and keeping it fun. So that's a big goal. And then just to welcome myself into an uncomfortable space, which is, hey, I'm the newbie. It's more important that I know what I don't know. And where were you a month after you started your practice? Or what worked, what didn't? What would you tell somebody who wants this smaller panel and is still going to juggle some clinical medicine and another job? And that's kind of what I'm excited to really learn about. I feel like a sponge in that sense of, great, I just here.
Yeah. They, you hear about the drinking from a fire hose kind of
Totally.
analogy. It is a lot, but it's great. And so going back to our previous conversation, you mentioned that you were working on kind of a hospital transition program.
Yeah.
How are you doing with that?
I'm doing great. It's funny, one of my old colleagues who's in administration caught wind and automatically just was like, wow, how does this not exist? And what are you going to be your KPIs and how you could make this your entire practice? And I was like, whoa. Like, I
They
was
just
like,
went, whoa,
yes,
went right
and-
for it.
yes. I was like, I mean, I know that fundamentally. So when I do program work, I like to work through a lot of the standard operating procedures, the template and messaging. So from a program kind of perspective, a lot of that is done. And again, it's really important to me to make sure that this is presented in a way to hospitalists, primary care providers. This is advantageous for all and a luxury for those who can have it. And so I'm refining that. I have some friends on both sides of primary care and hospitalists giving feedback. The key that I'm still waiting to kind of get signed off on is a little bit of the consenting process and the crossing T's, dotting I's, because it's the licensure and malpractice for DPC. How do I make sure that this fits within my malpractice coverage and within Colorado law? And that's slowing it down a little bit. So there's some creative ways around that. But I'm excited. A friend of mine was taking care of, she's an infectious disease physician and she's med peds and super smart. And her dad just had a surgical procedure. And she's like, can you believe that we're leaving the hospital and our discharge instruction is this one line? I'm like, yeah, I can.
What?
That is, I was like, told this friend, I said, this is the reality. Like, we're lucky to know fantastic hospitalists in our peer groups and the people that we train with, but the system is challenging and people are stressed and tired and you don't know how to take care of your father's post-operative X, Y, and Z. And you're a physician, like, what does it feel like for everyone? And so this brings this conversation. I was walking in the park and I was like, yeah, this is why I am where I am, because this is the population that I really have a soft spot for when they leave the hospital. It feels so completely overwhelming. And I said, that, like, great, call, text. If you're that family member who's left the hospital and you don't understand why the Foley bag is full at 5 p.m. and how are you going to get through the night? Well, yeah, that's why you change it into the bedtime bag and not the leg bag. Like, these things fall through the gaps. So anyways, to answer your question is, I've set kind of a tentative date of July 1 is the kind of the soft go to start to push that out, as long as not contracting, but consent and malpractice is done by then. But yeah, I'm excited.
Awesome.
Yeah.
Yes, I'm very excited about it. That's why I asked about it, because I think it's really such a unique idea and so needed. And like your colleague said, how does this not exist already? So I'm hoping other people will hear and maybe contact you and try to replicate it in different places.
Yeah,
It sounds fantastic.
Yeah, I hope so too. And again, there's nothing proprietary. Like, all I want is people to enjoy what they do. And so if you're on the opposite end, you're primary care and you love that and you want to know the documents that I end up at someday, like, I plan to just, great, here you are, healthcare colleague, here's my template, make sure whatever works for your malpractice and state law and have a go. And again, I think that's what has been very different about this space. And I think I talked about it last time when Brad Brown told me to go talk to Sherrod at Acute. And I was like, why would you're this competition? Like, I don't understand. Nothing makes sense. And again, it's been great to have people say, hey, here's the paperwork that I use. Ben Mendoza is my old hospitalist colleague. We had lunch and he said, hey, here's my referral network in the same area. And this is who I trust for cardiology.
That's great.
Yeah. And I thought, man, the community is very unique. So anyways, if you're catching this podcast, at some point, hopefully just be able to email me or you get it off of the Facebook Hospitalist to DPC group. But yeah, that's the goal, is to get this kind of something that I can then just say to others, hey, you're in Vermont, awesome, here it is. Or you're in DC, great, go forth.
Awesome. So you mentioned the Facebook Hospitalist to DPC group.
Yes.
It's growing.
Yes.
And so I can't remember, do you have any kind of qualification for it, or is it just straight up anyone is?
Hospitalist with an MPI.
Okay,
Yeah.
got it.
Yes. And I feel like it's my neglected stepchild right now.
I think you got a lot going on.
Yeah, I know. It's so funny. Yeah, I was thinking about that. And the goal is that those who are at DPC Summit can all get together But I love the space. New members are joining every day. I think we're still probably around 350 or so, but the need is out there.
Yeah. So you mentioned the DPC Summit and kind of getting together with hospitalists. And I think that this is probably going to come out before the summit. So did you want to make an open invitation to people?
Yes. So, yeah.
Whether you did or not, you just did.
No, I do. In fact, actually, I believe I put it up on the Facebook group as well. As of right now, I believe there's 2. I think we have a potential sponsor. And
Fantastic.
yeah, so we will be there. There will be more of us there than we know. The goal is that we can, again, not there's some uniqueness. I think there's some uniqueness in anyone who enters a new space. And the goal is just to make sure that as hospitalists who feels like probably the biggest foreigners in the space, we can build and get to know and support and make sure that, much like when my colleague said, hey, I know you think this is crazy, but you should totally do it. And you're not going to be the first. And I was like, awesome. To create that space. So yes, DPC Summit. I can't remember which night offhand. I will get everything finalized and send it out. But you find me on the Facebook group or email me or text me, and I will tell you where the meeting is happening. And it's open to anybody, right? And again, I think the coolest thing is that if you're established in the space or you're a specialist, anyone is welcome to join. I just have not pushed it out to the entire DPC world because I don't know what the sponsor's willing to cover yet.
Well, that's great. Well, you can give me the details and we'll put it in the show notes.
Awesome. Sounds great.
Yeah. So before we close, I apologize to people who are just listening. If you have a chance later on, you can go to YouTube or to Spotify to see the video. But Dr. Bost is going to give us a little tour of his new office. Yes.
Awesome. So let me turn off my ring light. So I try not to make people dizzy. So actually, this was kind of the patient experience. May have to flip around on my phone. So I have kind of what I call kind of walking in. Yes, I'm using my utility table as my desk for better light, but I wanted a very comfortable space for patient and family to come in. Again, not to feel very medical, with the kind of temporary OMT or massage table there. The utility cart for lab draws will be over there. And again, just very simple features to make it feel kind of more comfortable. And then that's the balcony outside.
The balcony door.
Yeah.
So he has beautiful natural light, some plants, some comfy chairs. It looks really nice and cozy. Yeah.
Yeah.
And that's all you need.
Yeah.
It's a room.
Yeah.
That's all you need.
Right. And it's funny, I intentionally there's no computer monitor. The goal is to not let technology much, again, like the photo of the doctor in the background, the goal is to have interactions that are not hindered by technology and to have contact and either write some hand notes that get shredded later, but it's meant to be kind of create that meaningful interaction space.
Yeah. Well, congratulations. Sure. It looks lovely. It's just perfect for DPC.
Love it. So yeah, and I enjoy it. It's gonna be great.
Yes. So let's see. So DPC Summit is in a few weeks. So look up, you'll see in the show notes the details for the Hospitalist to DPC get together. And if you want to find Dr. Bost online, we'll have all the information there. So in another 6 weeks or so, we'll catch up again. And so what's kind of your goals for the next time? Because you did so well this time.
I know, right? I think my goals are to really start to feel like this is becoming the practice that I want it to be, which sounds nebulous, but for me, that is the promoting of it, right? It is the next time we meet, I want my elevator pitch. If I don't have that perfect with you the next time, I expect you to coach me on that.
We'll work on it.
Yeah. So.
I think you will. You're going to be seeing a lot of DPC doctors in the next few weeks, so I think you'll be able to work on it. But yes, I was going to say, if you haven't gotten your messaging down yet, then that would be a fantastic goal.
Yeah. That I think that is exactly what I need to have down. And the hospital at home should be fully operational within the context is the other expectation.
That's exciting. Yeah. But the messaging, yes, so key, because unless you know what you're explaining, you can't explain it to anyone else. So
Yes.
Got to get that down, and everything gets easy after that. Well, maybe not easy.
Everything.
Maybe not easy. The messaging is easier. I take that back.
Well, I really appreciate you helping to get the word out to my hospitalist community. And
It's exciting. I'm glad that I really think, and we talked about this before, DPC is kind of hopefully an extension of someone's medical career as opposed to burning out, flaming out, and quitting.
Absolutely. I 100% agree. And I think let's make that a bumper sticker. Right.
Extend your medical career
Yeah.
with DPC.
Don't burn out, as you say, or something. So.
Yes. Yeah. Yeah.
Awesome.
Well, thanks again for coming back. We'll touch base again later, and I look forward to seeing you in person at the summit. And hopefully, a lot of our listeners will be there too, and they'll come and say hi.
Yes, come join me. Look for the ball and dime black glasses. So, awesome.
Well, thanks again. We'll talk soon.
Sounds great. Thank you.
Before you go, if you're a new DPC practice owner and you are struggling with being consistent on social media, the social media sprint is coming back. The next group is starting July 6th, but you can sign up now and get started on your brand voice and getting your posts and captions ready. You'll have prompts to help you schedule 2 weeks worth of social media that will go out automatically after you set it up. You don't have to think about it again. Go to the link in bio or the link in the show notes to sign up for the social media sprint. Thanks again for listening to DPC Life, and I'll see you next week for the next episode. Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you.